What is up, healthcare squad? Logie here with Healthcare Stress Relief, and in this video I'm going to be covering the 3 main symptoms of burnout and the things to listen to so you can identify it. You're going to want to stick around because if you are in healthcare, chances are you either have already experienced burnout, are going to experience burnout, or have coworkers who are burning out. And most healthcare professionals are going to experience burnout at least once or twice in their profession. So it's very, very good to know these things. And in 2012, a study was done with 13,000 doctors, and they found that 6 out of 10 of these doctors would quit their job if financially able to do so. Like a job that's raking in probably $200,000 a year, they would quit. And that's 60% of doctors would do this. And this is a career that many people revere as a very high career. When you go to dinner and you meet a doctor, you're like, oh, you're a doctor. So this is pretty big because it means a lot of these doctors are so burnt out that they just don't even want to be in the career that they once were so passionate about. And in order to understand burnout, we got to understand the symptoms. So there are 3 hallmarks to burnout. The first one is emotional exhaustion. Think about how you are when you are exhausted. When I'm exhausted, tired, and hungry, I am not a good person. I know you may disagree, but I'm not a good person. I'm snappy, I'm moody, and I'm annoyed and irritated, and I don't want anyone around me. So one of those symptoms in burnout is exhaustion, and with exhaustion comes all of those things. And on top of that, you just don't perform well when you're exhausted. The second symptom of burnout is depersonalization. You can consider this cynicism, and if you work in the emergency department, you know exactly what I'm talking about. I'm sorry, emergency people. I come from the ICU. We have to make fun of you guys sometimes, but when I did my clinicals in school, the emergency people are very cynical. I get along with you very well, but the most cynical people of all. And I think that's probably related to the amount of shit you guys have to see. It's pretty messed up. So you develop defense mechanisms and dark humor to cope with all of it. Yes, just being cynical, I find it funny, but it's not good if you are in healthcare, because over time you become so cynical that you start boxing people in. And I started doing this when I started getting burnt out. So you have a patient who has diabetes, for example, and they're a drug user and they weren't taking their medicine, and they developed diabetic ketoacidosis. And so you see enough of those patients and you begin to believe that all of them act the same, and all of them are, these aren't my words, they're worthless. Those are the things that you start to believe, maybe. And you start to treat those people like just garbage because you've seen so many of them. And unfortunately, burnout will start to cause you to become so cynical that you just don't care anymore. And that's the point where you shouldn't be in healthcare anymore. And most, I would assume most of society would agree with that, but unfortunately, there are only so many people who can become healthcare professionals. And if all of us are getting burnt out, who's going to step up? So there are a lot of people still in the profession who are just at that point of no return. I had many coworkers like this who were just, oh, when you grow up, you're going to hate your life. And I'm like, well, I hope that never happens. So yeah, that's number 2. Number 3, lack of a sense of personal accomplishment. And this is titled in, I can't remember the book, the Maslach hierarchy of burnout inventory. That's what it is. This is in efficacy. So this one is pretty interesting because it's basically a lack of purpose. And if you're like me, when you first started healthcare, you were just very spry, super happy to be helping all these people. And then over time, the system just starts to break you down and you start to feel like you're not doing as much as you could be. And that really tears at your morals because you've spent 5-10 years in school to get a degree, and then you start working with people, and then you realize that you're not actually able to do as much as you wanted to do. And I saw this in a lot of my coworkers. They weren't happy, so instead of finding something inside themselves to make them happy or make a change in their everyday life, they would go do something pretty big, like, I'm gonna go back to school to get a master's degree. Even though they didn't want to go back to school, they just felt like, I have to do something because I don't feel like I'm doing anything right now and I don't have any purpose. So they'd go spend $40,000-$60,000 on this master's degree, and then they'd come back and they'd start working and they'd feel good for a year or two, and then they'd go back to not feeling any sense of purpose anymore. So those are the 3 signs of burnout. Very important to understand them and to be able to know when somebody is burning out, yourself included. And so here are the list of statements I'm going to give you to just listen to yourself saying or your coworkers saying. If they're saying this means they're either already burnt out or they are burning out. I feel used up, empty, or dead inside. I feel hopeless, helpless, or lost. For me, I felt lost, very lost. I feel I have nothing left to give. I go to work and all I feel is frustration. I have lost enthusiasm in the work I used to love. I feel trapped, overwhelmed, overloaded, or overworked. I love my job has now been replaced by I hate my job. So if you're saying these things, and if you're watching this video, the chances are pretty high you're already saying these things. You got to start taking severe care of yourself. Like, take care of yourself like you take care of the patient who just came in who's so sick and about to die. That's how you should be taking care of yourself all the time. Sadly, we don't do that because we're too tired at the end of the day, and we spend all of our energy on other people. But you got to start making decisions for yourself. If you don't like your job, change departments. If you hate the profession altogether, quit. I know it sounds very scary, but you got to start doing these things for yourself. You have to be selfish so that you can then be selfless. It doesn't go 2 ways around. If you're so selfless, you can never be selfish because you're too damn tired to do anything anymore. So that's my challenge to you. Start taking care of yourself more. There are just loads of resources that I can send you and give you. One in particular, I have a free video training course on breathwork. Breathwork is absolutely amazing. It will decrease your stress levels significantly and boost your energy levels. I do it nearly every day. It's a game changer. I have a completely free resource. I'll put the link below. Just click on that, put your email in, and bada bing, bada boom, you are good to go. Let me know how that goes. Also, please gently hit the like button. Press subscribe, helps with the algorithm, and it will help me get the message out to more healthcare providers to take better care of themselves, learn more about burnout and how to prevent it, and hopefully change this giant problem of a system that we have in healthcare. So Logie is clocking out. I will talk to all y'all later. Thanks for listening. Ciao.